Hello, everybody. Good afternoon. Oh, that's really loud. That's really loud. That's loud, right? Oh. Yaya has a call. Okay. All right. Good afternoon, everybody. Thanks for coming. I'm very happy to introduce Pamela O'Brien, who's here from the Natick Walpole VNA. And she's going to be talking about diabetes, which I know is a condition that affects many, many people. So thank you so much.
Good afternoon. How are you all? So I was asked to give a little bit of a brief update on the Natick Walpole visiting nurses and the services we provide. So we are a skilled nursing. I can wait a minute. It's okay. It's okay. It's okay. So we provide skilled home care services. Skilled home care would be a skilled nurse, skilled physical therapist, which is what I am, skilled occupational therapist, home health aide. We have a speech therapist on staff, as well as home health aides. So those are the services we provide. Okay. We're still located over on West Street. We've been there for quite a bit, so we're still over there. Our number is on the folder. You can also find us online. That information's on there in there as well. Okay. So today I was asked to talk a little bit on diabetes and diabetic management. How are you? Good. The handout you have is from the American Diabetes Association. They provided a lot of great information on, again, the types of diabetes, the testing, the good foods for diabetes, nutrition, as well as the importance of physical exercise. So, is this too loud? I'm not really used to working with a microphone. Okay. So, we're going to talk a little bit about diabetes and the management of it. We're going to cover a little bit about the medication management, nothing specifically. I'll refer you back to your healthcare provider for that. We'll talk about, the best food choices and then the impacts of exercise. So, what is diabetes? Diabetes is a chronic condition that affects how your body turns food into energy. It impacts your body's ability to process glucose or sugar, okay? It's one of the most common chronic diseases. It impacts millions of people. I think one of the latest estimates is over 20 million people are impacted with diabetes. There are three main types. Type 1 is an autoimmune reaction that destroys the insulin-producing cells in our pancreas. Type 2 is what used to be known as adult onset diabetes, and that is when the body becomes resistant to insulin or doesn't produce enough insulin so that the sugar in our blood sugars, aren't consistent. Gestational diabetes occurs during pregnancy. It typically resolves once delivery has happened. It does put someone at increased risk for developing type 2 later in life. So there is another type that's now coming out or becoming more recognized is type 1A. It's also an autoimmune reaction where the immune system begins to attack or destroy our insulin-producing cells in our pancreas. Is this clear? Because I feel like I'm talking. Oh, okay. Is that better? Okay, I'll try to be consistent. Okay, so type 1 at one point was referred to as juvenile diabetes. Most of us may recognize that term. Type 2, as I mentioned, was at one point recognized or known as the adult onset. The terms that I've been using that we'll use, again, insulin. Insulin is a hormone that's produced in our pancreas, And it's responsible for helping our body store glycogen. So it helps our body store glycogen, which is what all our cells need for energy. Our muscles need it, our brain needs it, our vital organs need it. Glycagon is a hormone produced also in the pancreas, and that hormone helps to transfer or mobilize the stored glucose into the cells for energy. So, glucose, you probably know, is a simple sugar that provides energy to all of the cells in our body. The cells take in the glucose and they break it down for future energy. The glucose in the blood comes from the food that we eat, so it's true, we are what we eat. And your body does try to keep a consistent supply of glucose concentration in our blood. That's the ultimate goal, is to keep it very consistent. Problems arise when the storage or the release of the glucose is not consistent, such as in diabetes. Diabetes occurs when your body does not produce enough insulin or it is no longer sensitive to it. So it results in a higher level of glucose or sugar in our blood. Okay? Okay. So, as you can see here, just a simple graphic. Again, sugar in the body having no difficulty entering the cells for energy storage to be used when we need it. Then, in the far one, it's sugar in the blood having difficulty entering the cells. So again, it can be either too much sugar in our blood. It may also be an issue with our body being able to transfer or release the sugar in our blood to and from the cells. Again, as I mentioned before, the type 1 is an autoimmune reaction. It is usually diagnosed in children and young adults. It was one point referred to more commonly as the juvenile diabetes. It does require insulin therapy and lifestyle management, exercise, diet, regular healthcare checkups. Type 2 typically occurs when the body, again, becomes resistant to insulin or doesn't produce enough insulin, so that consistent level in our bloodstream isn't there. It's the most common form of diabetes, typically develops over the age of 45. It is becoming much more prevalent in the younger populations. That's also managed through lifestyle changes, diet and exercise, as well as oral medication. Some common symptoms of diabetes: frequent urination, increased thirst that just is not satiable, unexplained weight loss, blurred vision, slow to heal wounds, cuts and wounds that just are so slow to heal, fatigue, extreme fatigue, sometimes tingling in your fingers and your feet. Now, those symptoms can also be indicative of other issues. So again, if any of these are checking off, I'm going to refer you to your healthcare provider to go through and help figure out what possibly could be going on. Diabetes is, as we all know, is super important to manage to the best of our ability. Some of the complications of unmanaged or uncontrolled diabetes could include cardiovascular disease or heart disease, nerve damage, also known as neuropathy. Again, that tingling, lack of sensation in our feet and our fingers. Kidney disease or neuropathy. Eye damage, which is a retinopathy. You could have foot damage, and that may be the tingling or the sensation. It could be a neuropathic issue. It may also be wounds, wounds that are slow to heal. Some skin conditions, such as the wounds, And then also sometimes hearing loss. To go down. So, to diagnose diabetes, you may be familiar with some of these tests. There are some standard tests. One is the fasting plasma glucose test. One is an oral glucose test. The A1C, most people have, that's familiar to them. You can also do a random blood test, blood sugar test. So your A1C. The A1C test measures the average blood glucose or blood sugar for the past 2 to 3 months. The advantage of this testing method is that you don't have to do anything to prepare for it. When you go to the doctors, they draw blood, they can do an A1C. Okay. On the far side, you have just a little bit of the norms, what we want to target. So the target would be 70 to 180. Again, everyone is different. That's a conversation with your physician or your healthcare provider to have, is to help, they will help you interpret the results of your A1C. Typically, if your A1C is 6.5 or higher, that's a consideration, and that's when your healthcare provider will have a discussion about then how to go forward and how to best manage. The fasting glucose test is usually done first thing in the morning before you have anything to eat or drink, maybe except water, okay? And that checks your blood glucose after you haven't eaten for 8 hours. That's why typically first thing in the morning upon rising, you can have your fasting glucose test done. Okay. The oral glucose test is a 2-hour test that checks your blood glucose levels before and then 2 hours after you drink a really sweet drink. And that is going to let you and your healthcare provider know how your body is processing that sugar, processing that glucose. So those are the most common tests or way to help diagnose diabetes. Okay. So management and treatment. Healthy eating. Important for all of us for so many reasons. So it's a balanced diet, which is rich in fruits and vegetables, whole grains, and lean proteins. It's very important to monitor your carbohydrate intake to better manage. Again, the goal is to keep a consistent blood sugar level to avoid spikes and valleys. Physical exercise. Again, regular exercise really does help to manage not only our weight, it helps to lower our blood sugar, it improves our insulin, our body's ability to process insulin and be sensitive to it. It helps with stress, which also then impacts us in positive ways. As I mentioned, medications, the insulin typically for your type 1, oral medications, sometimes insulin for your type 2. And then, as we just talked about, would be the regular blood sugar monitoring, discussions with your healthcare provider, regular checkups, and then adjustments to your treatment plan as indicated. Some potential methods to help prevent or minimize the chances of developing type 2 diabetes. As we mentioned, healthy diet, regular exercise, maintaining a healthy weight, and then regular checkups with your healthcare provider. So, Important to understand what diabetes is. First and foremost, we understand it. We can talk about it, gather as much information as you can, have discussions with your healthcare providers. Okay, that's the key to helping prevent and manage many of our diseases, including diabetes. Support systems, always important. Importance, again, having a relationship with your healthcare provider, having ongoing discussions with your healthcare provider, talking with your family, seeing if you can get your family and the community involved in support for perhaps a walking group, nutrition classes, healthy recipe swaps. And then ongoing research, of course, there's ongoing research looking in attempts to help develop better treatment plans and potential cures. So, any questions?
One question. Isn't there a hereditary aspect to this?
There can be, yes. If someone in your family has had diabetes, you are potentially more at risk for developing that. So, again, prevention's the key. We all aim for prevention for any chronic disease. So, there are, again, if through healthy diet, exercise, that's been proven to really be effective in helping to lower someone's A1C. So, in the packet or handout, again, this is from the American Diabetic Association. Lots of great information available from them. Phenomenal support as well from them, either online or by calling them, okay? They included, if it's applicable to you, keeping a log of your blood sugars. If your physician has asked you to check or monitor your blood sugars, important to write it down. Jot it down on a log, along with your blood pressures or what other factors you could be monitoring. So that's included in here too, is if you choose to use it. And then the far back is some healthy snack suggestions, talking about carbohydrate, counting your carbohydrates, managing the carbohydrate level or intake, okay? Best food choices, as we talked about, the fruits and vegetables, as well as your multigrain, complex carbohydrates, lean proteins, nuts, okay? Fruits and vegetables, they do contain, especially your fruits, they do contain natural fructose or natural sugar. It may be recommended that when you have your fruit, that you have a little bit of protein to go along with that fruit. That protein and fruit combination helps our body to process that natural fructose or sugar that we're getting from the fruit. So.
I would say that when you're talking about fruits and vegetables, not like I've got orders, don't eat any cherries, don't eat that, don't eat bagels, don't have ice cream.
So there may be other reasons why your healthcare provider is suggesting that you avoid certain foods. There are certainly the bagels, tend to have a higher content or higher carbohydrate content. So there's reasons why. So I know grapefruit's contraindicated for some individuals with other healthcare diagnoses. So you have to, again, have a conversation with your healthcare provider, request a nutrition consult, because they're phenomenal with all kinds of really good, helpful suggestions and how-tos and recipes. So.
I have a question about
Absolutely.
nutritional, asking someone to have where would you call for that?
I would call your healthcare provider. Right. We do not have a nutritionist on staff, unfortunately. So what I would call your healthcare provider, the nurse practitioner in the office, or call and ask to say that you're interested in having a referral to a nutritionist. They don't have the time. Yeah. At one point, you're right, I worked in acute care for many years, and there was a nutritionist on staff, and he or she would meet with the patient, have discussions, provide the education prior to discharge, and that, as you just said, doesn't always occur. So, so call your healthcare provider or the office and have a question in the office, and hopefully they can refer you.
A nutritionist and a dietitian, because they both do something different.
True. Mm-hmm. Yeah. So, yeah. You can answer if you, feel free.
So the nutritionist tells you the nutrition of the food. The dietitian says, okay, well, this has this, but you don't eat this. That's not gonna help you. So let's say you don't like pizza. Then the dietitian will help you make a meal plan with the good stuff, which is your nutrition, around the foods that you do like to eat. Because there's no reason to give you a diet that's full of salad if you're not gonna eat salad. That make sense?
It does make sense. Thank you. Yeah. So.
All that education.
You know, the other thing is too, I had to go out and buy books on low salt and stuff, for example. There is nothing. You have to go online. That's what I rely on.
Yeah, online is a great resource if you have the capability, or if you can come in here and have someone assist you. Truly, and it's hard. The low sodium, the sodium's hidden in everything. Yeah, so it's education. Once you get used to, once you get used to reading the food labels, reading the nutrition label on your foods, understanding what your packaged foods contain. Yeah, it's a process. Always good to shop in the perimeter of the store, if you will. Most grocery stores are set up similar. You know, the milk's always in the far back because then when you walk through the store to get to your milk or ice cream. But again, if you shop in the perimeter, so you have your fresh fruits and vegetables, you have your meat and deli counter perhaps, higher in sodium though, and then you walk through and then you have your dairy on the way, you know, so, yeah, so. But I always think the perimeter of the store, don't zigzag through the aisles. It's far too tempting to zigzag through the aisles and grab certain foods that it looks so good. So, yeah. So again, any questions? If you yourself or if someone that you know is having a difficult time managing diabetes in their home, having a difficult time managing if they're on medication, prescribed medication for diabetes, you can always call your physician or give us a call. If we feel that a skilled nurse is indicated to come out and provide some extra one-to-one education, then that's something that we can have a discussion with your physician. So, okay. You're welcome. Yeah, you're welcome. Oh, 100%. Yeah, our metabolism is different. It's very individual. Yep. Medications that we're on affects our metabolism. You know, as we age, we all know our metabolism changes, so we metabolize not only our meds differently, we metabolize our food differently.
I'm not diabetic, but I'm on Jardiance because it's correcting.
Cardiac.
It's correcting.
Yeah.
What do you call it? Stiff heart syndrome.
Yep.
But it's CHF on the diaphragm.
Yeah. Yeah. Jardiance does have a nice cardiac protection. It does. Yep. Yeah. So. I do. We do. If anyone needs a new pill box, we have them up here, welcome to take them.
Very interesting.